everybody. I wanted to give you a little feedback on care planning. I've just started looking at the care plans, but I'm seeing some of the same problems that I've seen in the past, so I'm just going to put some feedback out there that will probably be helpful for most of you. So in order to understand how a care plan works and each of those parts, you need to think about goal setting in your own life. So let's think about if you were to have a goal of getting a B on your exam. You have a plan, you know what you want, you know how you're going to study, and you were going to evaluate whether or not this plan is working for you. So you get your first exam back, and even though you did everything that you wanted to do in order to prepare for that exam, you did not get the B that you wanted. You got a C. And you still want to get a B on your next exam, so you want to change things up a little bit. So that is the part where you're evaluating your goal. So if your goal was to get a B on the exam, you have a date when that exam is going to happen, and you're going to evaluate it. It's a very clean type of did you or did you not get the B that you wanted. If you did not get the B that you wanted, then you go back and you think, how could I have done things a little differently to get a better outcome? So I wanted to bring that up because setting goals can be a little challenging. And I think that sometimes students don't really understand the purpose in setting goals, so the goal section on your care plan. So I think I talked about having SMART goals, although it's probably worth a reminder. So SMART stands for specific, measurable, achievable, relevant, and time-bound. So we want them to be specific. We want them to be specific enough that if somebody else read your goal, they would be able to say, yes, that goal was met. No, that goal is not met. It needs to be measurable. If you said, I want to do better on the exam than what I did last time, that's not really measurable for somebody else to come in and look at because it's just better. If you say, I got a C last time, I want to get a B this time, that is measurable. So then you say, I want to get a B on the next exam. Achievable. Is it achievable for you to get a B? I'd say yes. Yes, it's achievable. Is it achievable for you to get an A plus? Nope. It's not going to be achievable for you to get an A plus. It's not a realistic goal, and it's not really a good use of your time to try to get the A plus when an A will suffice. Is it relevant? If you said that you wanted to get a B on your med-surg exam, and what you evaluated for a goal and the goal that you met was that you got a B on your chemistry exam, that's not relevant. It is something completely different. It's kind of off topic. Time bound. If you don't have a time to evaluate your goal, then it never gets evaluated. You never look and see whether or not your interventions are doing what they're supposed to be doing in order to get you to that goal. So what I'm seeing for the times, I'm seeing a lot of by discharge. And my thought is, okay, but what happens if this person doesn't meet this goal? They won't get discharged. So therefore, those goals aren't ever being evaluated, and the care plan isn't being evaluated to see whether or not it's effective. So some of those interventions might need to be switched up. Let's say they're on an antibiotic. Antibiotic's not working. You need to talk to the doctor. Hey, still having this antibiotic. It's not really working that well. Still having lung sounds that sound like XYZ, and white blood cell count's still elevated. Patient still has reports of chest pain, shortness of breath. Need to get something different going, right? Maybe they need to have a bronchodilator added to their regimen. Maybe you can make that suggestion, right? But in order to see whether or not they're meeting that goal, we have to have it time bound. So I really like to have time bound being with a date. So how long do you expect it to take for them to be discharged? If they're doing well, you should be able to say, if they're doing well, I think that they will be discharged in 1 week. Maybe it's 2 weeks. Maybe it's a month. Maybe, whatever, depending on what the condition is that that person has, so that you can have a date to see whether or not they are doing what they need to do. So I hope that this helps you out when you're looking at your care plans. I think goals are probably the most challenging. Evaluation of goals, I like that so far I'm not seeing goal met, goal not met, and then nothing else. I like that you guys are putting some thought behind it and adding a little bit of extra to it. I'm seeing that your assessments, I know that with a VSEM, it is what it is to a certain extent, but I am seeing that you guys are organizing your data well. I I'm not sure that I'm seeing labs being interpreted for everybody. So I'm just going to put a little reminder out there that that's part of your defining characteristics. It's not just this person has an elevated white blood cell count. It is this person's elevated white blood cell count. It's probably elevated because they have a current infection. So when you're looking at the labs that are outside of norms, that you're putting just like a real quick statement of why you think that they are outside of norms. This person's anemic. Well, why do you think they're anemic? Well, because they've had a GI bleed and they lost blood, so that's why their blood counts are low. So just kind of starting to pull those things together. So I hope that helps you.